Hey everybody, welcome back to the channel. So today I am going to show you a couple of different easy self-mobilization techniques to help with tennis elbow, lateral epicondylitis is like the proper name for that, and even possibly radial tunnel syndrome. So there's going to be a couple different techniques that we go over today for all my therapists watching. These are something that I often give my patients as part of their home program because I think we can really empower our patients. We know that these syndromes like tennis elbow are going to be with them for a pretty long time, anywhere from 6 months to like a year and a half. So if we can help them to manage their pain and their symptoms and help them, help empower them to treat themselves kindly and do good things for their body, they're going to be feeling a lot better, a lot quicker, and feel like their pain is actually a little bit more manageable. So I usually call these like active release technique or self-mobilizations. So that's how I usually document it. But yeah, let's get into it. So the first active release technique that I will show you guys is truly active release. So you can do this on your patients in the clinic as part of your manual treatment. You can teach them how to do it on themselves at home. The way that I usually start is getting them in a position where they're comfortable, where their wrist has mobility, but usually their forearm will be supported in that position. So I usually have them kind of relaxed over a ramp. I don't usually have them straight arm because that usually tends to be a little bit aggravating for our tennis elbow people, but just kind of relaxed over a straight edge. They could use like a desk or a tabletop or whatever they've got at home, an armrest, all those kinds of things, but making sure that it stops here so that their wrist can have full movement. And then what you'll want to do is you'll kind of palpate along the muscle bellies, so all of those extensor muscles along the back up until the common tendon insertion, right? And you want to kind of put pressure into some of those spots. So I usually start right up at the tendon, like the musculotendinous junction kind of area, because that's usually like a really nice little trigger point or a real sensitive spot that tends to kind of get tight and scarred. So I'll usually start kind of there. And what I'll do is I'll actually put pressure with my fingers into that spot, and then I'll start them almost in like a wrist extended position. I'll put the pressure there, and then I'll have them count to 5 and slowly lower their wrist into flexion. So it's a super slow controlled movement. They're going to feel resistance on it, and it's good for you to tell them that that's normal. You expect to feel some resistance. It might feel hard to kind of push through that. And what you're essentially doing is you're putting pressure on the trigger point or the tight spot, and then you're putting a stretch of the muscles through that spot. So it's going to help that trigger point to release. So usually feels uncomfortable, but afterwards it usually feels really good, and patients actually really like this technique. I've had a lot of people that use it a lot at home, and so I'll have them do that maybe like 3 or 4 times, somewhere in that range. They can also actually do like a little rotation on the end of it too, so you can kind of push in that spot and then again have them flex their wrists down and even do like a little bit of a forearm pronation with it. And they can do the other way too. You kind of have to figure out which spots are the most tender and which muscles are the most tender, but you can help guide them in how it's going to feel the best for them. The other self-mobilization that I really like to teach my patients and use in the clinic as well is a radial head mobilization, because I feel like in probably 80% of the tennis elbow cases I see, people have a little bit of radial head issues, and kind of the positioning of the radial head tends to be off just a little bit, and the olecranon as well, certainly, but that's for another day. We'll work on the radial head first. So sometimes the radial head actually gets shifted too far posterior or anterior, and so people can actually mobilize their own radial head at home. And it's again kind of an active release technique, so putting pressure in and then doing a certain type of movement. So to do kind of like an anterior radial head glide, you can have your patients find like along the back side. It's like a soft spot right in between the 2 bones, and it's pretty tender because the radial nerve also kind of runs, along that zone. But you want to almost kind of hook your fingers into it And then you'll start in either pronated wrist or neutral wrist, and then you're going to have them kind of put pressure there. Don't let those fingers budge, and then they're going to rotate their palm upwards, and that's going to help to mobilize that radial head. And you can, they don't have to do it so slow. You can have them do it a few times. It usually feels really good, and it's something they can easily do on themselves. And then again, vice versa, you can also do the opposite way, right? So the radial head sometimes gets too far anterior and you need to push it back posteriorly a little bit. So it's literally just the opposite. So in this position, you want to kind of get those fingers just anterior to the radial head, and then you're going to have them go from supinated position to a pronated position. And again, just trying to shift that radial head back a little bit. And again, that usually feels pretty good. It just kind of loosens things up. So that's kind of an easy radial head mob you can do at home, just using kind of a little bit of pressure from the other arm and doing a little bit of rotation of the forearm. So yeah, 2 easy active release techniques that can be really helpful for people that have tennis elbow. Again, I think empowering our patients to provide treatment to themselves is really crucial, especially with repetitive strain injuries that we know they're going to have for a pretty long time, and it's going to last longer than the point where insurance will pay for them to come to therapy. So the more we can empower our patients and treat them, kind of knowing that and give them the tools that they need to succeed, the better off they're going to be and the happier they'll be with you as well. So I hope that video was helpful. If you guys liked it, please give it a thumbs up and don't forget to subscribe to the channel, and we'll see you next time. Thanks for watching.